Welcome to Usmle World, where we ask, answer, and explain Usmle questions. Today, we're diving into Step 2, ENT. Let's get started with question number 1. For the following case, which of the following processes most likely occurred during the first farm visit 2 years ago? A. Antibody receptor aggregation. B. Complement activation. C. Mast cell degranulation. D. Release of interferon gamma. E. T-lymphocyte induction. The case scenario is: a 10-year-old girl is brought to the office due to sneezing, rhinorrhea, and nasal congestion and itching. The symptoms began 2 days ago after she arrived at a family farm for a summer vacation. The patient has spent a few days visiting the farm during previous summer seasons. She had no symptoms at her first visit 2 years ago but recalls having similar symptoms last year. She has had no respiratory symptoms while residing in another state the rest of the year. The patient has no prior medical conditions and takes no medications. On physical examination, the nasal turbinates are enlarged and bluish, and clear rhinorrhea is present. An allergic response to a farm allergen is suspected. The question is: which of the following processes most likely occurred during the first farm visit 2 years ago? Your options are: A. Antibody receptor aggregation. B. Complement activation. C. Mast cell degranulation. D. Release of interferon gamma. E. T-lymphocyte induction. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is E, which is T-lymphocyte induction. This question is designed with the focus to assess your ability to make a diagnosis. This patient with allergic rhinitis, presenting with location-based sneezing, rhinorrhea, and bluish and congested nasal turbinates, likely became sensitized to farm allergens during her first visit. Allergic rhinitis is a form of type 1 hypersensitivity, a process that involves sensitization and elicitation phases. Sensitization occurs when inhaled antigens penetrate the nasal epithelium and are presented on major histocompatibility complex 2, causing activation of naive T helper cells. The release of cytokines, like interleukin-25 and interleukin-33, from the nasal epithelium causes T helper cells to differentiate into Th2 cells that secrete interleukin-4 and interleukin-13, and other lymphokines that stimulate B-cell maturation and production of IgE antibodies. Antigen-specific IgE antibodies then bind to the high-affinity IgE receptor on mast cells, priming the patient for an allergic response. Repeat exposure to the inhaled antigens, like on subsequent visits to the farm, cross-links IgE antibodies on the surface of the mast cell, leading to IgE receptor aggregation, which causes mast cell degranulation. This releases histamine and other vasoactive mediators that lead to nasal inflammation, producing the allergic response. Subsequent exposure to the same antigen can lead to further allergen priming, worsening symptoms over time. If you choose any option other than E, you are wrong. Let's briefly discuss the other options. Choice A and C, which are antibody receptor aggregation and mast cell degranulation, cannot be the answer because repeat exposure to the inhaled antigens, like on subsequent visits to the farm, will cross-links IgE antibodies on the surface of the mast cells, leading to IgE receptor aggregation, which causes mast cell degranulation. Choice B cannot be the answer because complement activation occurs in type 3 hypersensitivity reactions, in which immune complexes deposit in the basement membrane of small blood vessels in the skin, kidneys, or joints, resulting in vasculitis. Complement does not play a significant role in type 1 hypersensitivity. Choice D cannot be the answer because interferon gamma is secreted by Th1 cells, which activates macrophages and, along with interleukin-2, stimulates CD8 cytotoxic cells. It also inhibits, rather than enhances, the Th2 cell activity that drives type 1 hypersensitivity reactions, like in allergic rhinitis. Your take-home message from this question is that sensitization to aeroallergens occurs when inhaled antigens induce T helper cells to differentiate into Th2 cells. The Th2 cells then promote B-cell maturation and ISO-type class switching to IgE. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. But if you are unable to determine the answer, you really need to watch this episode again. Remember, understanding is the foundation for growth. Unlock the secret to acing your medical exams, especially the Usmle, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.